I'm starting it. It's recording.
Okay. The masseter originates on the zygomatic arch and zygomatic bone, and it inserts on the ramus of the mandible. The temporalis originates on the temporal bone, and it inserts on the coronoid process of the mandible. The sternocleidomastoid originates on the sternum, the underside of the clavicle, and it inserts on the mastoid process. The pectoralis major muscle originates on the sternum and the clavicle, and it inserts on the greater tubercle of the humerus. The pectoralis minor originates on ribs 3, 4, and 5, and it inserts on the coracoid process of the scapula. Serratus anterior originates on ribs 1 through 8, and it inserts on the anterior vertebral border of the scapula. The coracobrachialis originates on the coracoid process of the scapula, and it inserts on the medial shaft of the humerus. The deltoid has 3 origins, one on the clavicle, one on the acromion process, and one on the spine of the scapula. And then all 3 of those origins have one insertion point on the deltoid tuberosity of the humerus. The subscapularis muscle has its origin in the subscapular fossa of the scapula, and it inserts to the lesser tubercle of the humerus. The teres major and minor muscles originate on the axillary border. This is teres minor, and this is teres major, and they insert on the teres major inserts on the lesser tubercle of the humerus, and teres minor inserts on the greater tubercle of the humerus. Latissimus dorsi originates on thoracic 7 through lumbar 5 vertebrae, the sacrum, and the iliac crest, and it inserts on the groove in between the lesser and greater tubercle of the humerus. So the groove right there. The brachialis originates on the shaft of the humerus and inserts on the coracoid process of the scapula. The ulna. The biceps brachii, long head, originates on the glenoid tuberosity and inserts on the radial tuberosity. The short head of the biceps brachii originates on the coracoid process of the scapula and inserts on the radial tuberosity. Supraspinatus originates on the supraspinatus fossa of the scapula. It inserts on the greater tubercle of the humerus. Infraspinatus originates on the infraspinatus fossa of the scapula and inserts on the greater tubercle of the humerus. Adductor magnus originates on the ischial tuberosity and inserts on the linea aspera of the femur. Adductor longus originates on the pubic ramus and inserts on the linea aspera. Adductor brevis originates on the inferior pubic ramus and inserts on the linea aspera. Gracilis originates on the inferior pubic ramus and inserts on the medial tibia. Pectineus originates on the pubic crest and inserts on the pectineal line of the femur. Hard to. Pectineal line of the femur. The sartorius originates on the anterior superior iliac spine and inserts on the medial side of the tibia. The rectus femoris inserts on the anterior inferior iliac spine and inserts on the patellar ligament. The vastus lateralis and vastus intermedialis originate on the femur and insert to the patellar ligament. Vastus medialis originates on the linea aspera and inserts on the patellar ligament. Semitendinosus and semimembranosus originate on the ischial tuberosity, and the semitendinosus inserts on the medial tibia, and the semimembranosus inserts on the medial condyle of the tibia. Biceps femoris long head originates on the ischial tuberosity and inserts on the head of the fibula. The biceps femoris short head originates on the linea aspera and inserts on the head of the fibula. Is that it?
Mm-hmm.